Coronavirus is affecting families across the country, and there's worry that there will be long-lasting health impacts. Alcohol sales seem to be up during the pandemic. Joining me now is addiction expert Melissa Caldwell Engle. Thank you for joining us tonight, Melissa.
Absolutely.
So first, have you seen an increase in alcohol abuse during the pandemic, and do you think that the stress of the pandemic is what's causing people to continue to drink?
Yes, and yes, absolutely. And a lot of the built-in pieces of all of this also that goes counter to what is a healthy human being, like having contact with people, spending time with people. So a lot of this, there's some people that believe the opposite of addiction is connection. It's not even about sobriety as much as it is about connection. So when you lose your ability to connect with others, it taxes and stresses us.
And Melissa, how much drinking is considered too much?
Well, different people would answer that different ways. But when your drinking starts to interfere with your ability to manage your daily life, if you find yourself needing more and more to get the same effects, if you find yourself drinking when you told yourself you wouldn't, there's kind of a list of criteria that you can go through, but those are kind of the basics. And if you continue to drink despite the negative consequences, that's a problem. That's a problem with alcohol. Well, a couple of things that happens when we have a national crisis, because I've been through a couple of these. I mean, I was practicing after 9/11. What tends to happen is if we have any kind of painful experiences from our past that we have pushed down and suppressed, when we have a state of emergency or a crisis, and this one's gone on for so long, any of the feelings that have been suppressed or pushed down from your past will start to bubble up. And so people that have got a lot of struggles from their past they've not dealt with, this is the time it starts to unfold. Now, I understand that people are getting out more, but with that brings some of its fears as well, because there's a lot of mixed feelings about people going out more and more, and we're still following the news and hearing about the COVID cases. So I really encourage people not to live in a state of fear. And if you notice that you have struggles with depression or anxiety, in addition to your panic about about COVID, that you talk to someone, that you reach out to someone, because sometimes COVID is just kind of what takes the lid off of a lot of stuff that has been suppressed in the past, and you need to work through these things.
And how can friends and family spot alcohol abuse?
Oh, if you can see differences in their behavior, obviously you can see if they're inebriated, but quite often with alcohol dependency, you'll see other behaviors that happen as well, like isolation. There's responsibilities and obligations that continue to slip through the cracks that people aren't able to manage. So you'll start to see other areas, unfortunately, in their life start to spin out of control.
And Melissa, maybe what are some good resources for people who maybe are struggling with heavy drinking?
Well, I would say don't wait till it's heavy. If you notice that you're drinking more, and you didn't used to drink this much, and you're drinking more than you used to drink. If you notice that your anxiety, or you're having a hard time sleeping, or you're struggling with more depression or negative, dark thoughts, telehealth right now is so available. I mean, you could just Google therapists in your area, so it's easier now than it's ever been. And if you're someone that's struggling and you've been drinking quite a bit where there's some physical dependency, the proper course of action would be to get yourself into a detox facility. Look at coming to a facility like Healing Springs Ranch, where we help people. We're a residential facility for drugs and alcohol, where you can come in and be in an environment where you won't have access to alcohol, and you'll be able to do some counseling and have a supportive group to help you kind of break this pattern that you've gotten yourself into. So I would just encourage people to start with telehealth. It's so readily available right now.
Some very good insight tonight. Melissa Caldwell Engle, thank you so much.